Imagine a parent, a grandparent, or a close friend has just come after surgery. They are recovering alone. You check in when you can, maybe over a call or a text, but what happens in those moments in between? What if they need help and can't reach for a phone? I faced this firsthand. My grandmother was alone when a fire broke out. She couldn't call for help and we lost her. That tragedy made me ask a very difficult question. How can we be present for the people we love, even when we are miles away?
So we did our market research. So there are approximately 15 million plus at-home care patients and also seniors who live far away from their close ones. And this also leads to fatal injuries. And US healthcare system, as we know, it costs a lot to deal with that. And it might cost life as well. So here we are with the new solution that we have implemented the mobile app. It's called RiskItFree, where we are taking the onboarding flow for the patients, and we can also add patients or our loved ones who needs to be monitored, and we can also add new spaces like a living room or hall or anything. And this is basically we can add the members who tend to stay there, and we also provide the scores, safety score for each room, and it is also like friendly, as in the patient or the user can actually uh, capture the photo of the room, or we tend to capture it automatically, but right now we are capturing it manually. And they can also zoom in and check the boxes. Here we can see that it has recognized that it's a rug on the floor and then uneven surfaces, and they can also listen to it, and it summarizes the entire thing on what to do and recommended, what to be recommended. And this is the chatbot that we have implemented using agentic AI. It basically answers all the questions like, is my father safe? Or they can ask various other questions that we can interact with. So this is the chatbot, and even that is interactable as well. We can click on the speaker icon and it's going to talk out loud to you. So there is also like a profile thing where you can edit our information, the user information, and this is the app that we've implemented.
Our RiskItFree app has three main highlights. One is the personalized safety score for every room. Based on the patients who tend to spend time in that room, we give them particular personalized safety scores and personalized safety recommendations. These recommendations and chatbot are very scalable, and we are powering them using AI to also detect hazards with visual feedback for those who cannot read or are not able to understand English. In order to use AI responsibly, we are focusing on three things. First is inclusivity and safety. We are being as inclusive as possible by enabling text to speech and various other features. We have transparency and explainability, which is we are explaining what we are capturing and how we are using that in our app, as well as we are showing them the whole history of all the scores and all the uploads they have done before. We have reduced bias and we have improved reliability by using a safety guardrails with our AI agents. What lies in the future? We are continuously monitoring real time, which will look at every unexpected spill to every kind of hazard which can happen in real time and keep the person safe. We are also planning to improve performance, which is incorporating motion sensors along with images, as well as fine-tuning the models using reinforcement learning with human feedback, scaling it up, and using safety guardrails, which will even further improve the performance. We are trying to get more control for the caretakers. That is, in case of emergency, they can call for help or 911. And we want to go beyond safety in the future, which is tracking sleep, steps, and eating habits of the person we want to monitor. This is us, Prerna and Pratik, signing off, and our app RiskItFree. Thank you.